people can take supplements of vitamin C, zinc. Do they have any side effects also? Because people are taking tablets daily, and vitamin D also. Some people are taking for months on end. Is there some stipulated time that you?
Yeah, one should check frequently vitamin D and vitamin B12 level, because persons are taking too less, and then ultimately some toxic symptoms may occur because of the quite high level of vitamin D and things.
Zeneca and AstraZeneca का काफी मेरा attachment रहा है. I was in England for 17 years, so where I was a consultant in Manchester, so just south of Manchester, AstraZeneca का headquarter था, and I have operated quite a lot of employees from AstraZeneca. And AstraZeneca का phase 3 already start हो चुका है. And I think NHS में, which I have talked to a couple of my friends in UK, I think it may roll out next month to the healthcare worker. थोड़ा hitch था उसमें, because one 28-year-old who received a placebo, he died due to unexplained health problem. So कुछ दिनों के लिए उसको बंद कर दिया था. लेकिन I think yesterday or day before yesterday, I think they came up with the result that it is very well tolerated and there is a sufficient immune response even in old patients, those who are more than 55. So one is AstraZeneca and University of Oxford. They are producing in 2 centers in UK, 5 in Europe. India is also a part where AstraZeneca is going to be developed in Serum Institute in Pune. Second one, which is quite prominent, which is coming, is a US-based Moderna. That is also in the phase 3. The third one is a Pfizer. They have collaborated with the German pharma company BioNTech. They are also in the phase 3. Other which is significant, one is which is developed in China. I think it's called as a CanSino. With the Beijing Institute of Biotechnology, they have already started giving vaccines in China, and same is the Russia Sputnik as well. In India, the most important thing is our Covaxin, which is by the Bharat Biotech India and also ICMR. It is getting into the phase 3 trial. And Zydex Cadila is also, I think, is completing phase 2. And Panacea Biotech is also, it was in preclinical stage. So there is a lot of vaccines which are coming. And most likely we will have a vaccine, I think, end of this year, or realistically it will be early next year. Early next year.
So is that going to be a solution? Is it going to be very effective? What is your opinion?
I think we have to look at the other problem which we faced in the past, like tuberculosis, mumps, measles. We developed the vaccines for that, tetanus as well. So obviously that time will tell. That time will tell. But all of them, whether it's a live vaccine or whether vaccine uses a dead virus, that only the time will tell which vaccine is the best.
Okay, so here's another.
Number 2 is that we are not sure that if vaccine comes, whether it will have antibodies for 2 months, 6 months, or what. Because the patients, now it is being found that patients who have recovered from the COVID-19, they are again getting COVID-19 as a second time, because the antibodies which they acquired was temporary. So all these things are very shaky at this moment, and I think we may be clear by this for next 6 months, which may be.
Yes, sir. I think Dr. Vasudevan wanted to add on something to it. So, were you saying something?
And Dr. Rawat explained where and how many vaccines are there, and Dr. Bhargawa suggested the clinical problems with vaccines. Now, I think the intention of the vaccine is not to eliminate. What we want to realize is the intention of the vaccine is to try and minimize the burden of the disease in the population and on the healthcare system. It is not a cure. So as a person, as a layman, as a patient, if I expect that I will get one tablet or an injection and then I have no fear, मैं अमिताभ बच्चन बन के घूम सकता हूँ, मुझे वायरस नहीं आएगा, ये गलत है. Vaccine is not aimed at that. Vaccine is aimed कि आपको बीमारी हो भी जाए तो माइल्ड हो. वैक्सीन के बावजूद आपको माइल्ड बीमारी शायद हो सकती है, ये हमें ठीक से नहीं पता. तो जब भी वैक्सीन आएगी, जब आएगी, ये गेसवर्क है और हम उम्मीद करते हैं कि एंड ऑफ दिस ईयर या अगले साल, जैसे डॉक्टर रावत ने कहा, मिल जाएगी. पर जब भी आएगी, वो जो फियर है वो चला जाएगा. एक दूसरा ये कोशिश होती है कि सीरियसनेस, जो पेशेंट्स आईसीयू में अभी आ रहे हैं और हमारे पास 20 आईसीयू बेड है तो 25 पेशेंट आ रहे हैं, और जो पेशेंट्स हमारे सामने आईसीयू बेड नहीं दे पा रहे हैं, वो जो सिचुएशन है सबसे पहले वो कम हो जाएगा. वी कैन गेट ऑन विद लाइफ, बट दिस फैक्ट दैट वैक्सीन आएगी, मैंने वैक्सीन ले लिया, मैं मास्क नहीं पहनूंगा, ये मत सोचिएगा. वैक्सीन लगा लिया, मैं बिल्कुल ठीक हो जाऊंगा और बेफिक्र होके घूम पाऊंगा, ये भी सही नहीं है. So vaccine is going
that is a wonderful observation. Yes, this is from a viewer. My husband also had similar symptoms of COVID and acute pancreatitis. His CT scan shows no gallstones. CT findings showed acute pancreatitis with almost 80% of pancreas affected. This happened in the month of May, June. Now he is fine. What precautions does he need to take now? So please, would you all elaborate what to do after acute pancreatitis? Any precautions you would suggest?
Well, अभी precautions लेने पड़ेंगे. जैसे the person has to take some digestive enzymes और some acid secretory, जो anti-acid secretory agents हैं वो ले, थोड़े enzymes जो आजकल मिल रहे हैं वो ले, and take care of the things, because there is no specific treatment जो ऐसा treatment हो कि जिससे pancreatitis जाएगी. But उनको ये चाहिए कि उसका सबसे पहले ये कॉज पता करें कि भी क्यों हुई है, जिससे दोबारा पैंक्रियाटाइटिस ना.
Okay. Please.
what we need to realize is that जब मुझे भूख है तब मैं खाऊंगा तो फायदा है, भूख नहीं है खाता रहूंगा तो उसका भी प्रॉब्लम आ जाएगी. So the utility of vitamins is marginal. The utility of vitamins in boosting immunity, in preventing coronavirus, in enhancing self-esteem, हमारे दिमाग में ज्यादा वो एडवांटेज देता है कि यार ये प्रॉब्लम है, ये ऐसा है. Right? So some of the vitamins get flushed out if they are excess. They don't create problems. Some of them get retained in the body and then accumulate and create toxicity.
Very true.
Like I said, vitamin D is one of them. So it's not a good idea to self-medicate. I think we've done a lot of work and studied medicine and spent so many years just to be of help. So my request to you is not to try and do everything yourself. Google is a decent doctor, but there is utility to going to medical school and literal experience rather than a textbook and Google kind of a questioning and answering. Let this not be यार वेबिनार में मैंने सुना था ये ले सकते हैं, मैं चलाता ही रहूंगा, ये नहीं होना चाहिए.
Thank you. I would throw a question to each one of you about the role of gut microbiota. Is taking curd somehow influencing it positively, or what's the role of microbiota on developing the immune system and fighting with COVID?
Actually, microbiota जो है वो we have got trillions of these present in the intestine and the form of mixture of bacteria and some virus and fungi also. And what they are doing is they are very beneficial for health, including vitamin production, absorption of ions, especially calcium, magnesium, and iron. And they protect against pathogens by enhancement of the immune system. So microbiota are very important, and they also help in fermentation of undigestible foods like cellulose. So they are very important in the thing, and one should add there. So the important thing message here about microbiota is that they are very protective against infection also and helping in undigested food. Now, these also aid in digestion and in the production of feces, flatus, and gas, which is produced by microbial fermentation of undigested food. So that's their important, and they are plenty of available. One should take yogurt, which I told already in boosting thing, and if they can also add, some persons, if they are having want more, then they can add probiotics, which are available in the pharmacy, and which they can add also. So I think I want to tell that they have very important role to play in digestion and to increase the immunity of body.
Thank you so
I
much.
think, I think to make it more simpler, like we talk about cholesterol, that we've got bad cholesterol and a good cholesterol. So in the gut, we have got organisms. Some of them are good, something like lactobacillus, which is good, which is correlated with the higher level of IL-10. Then we got a bad one like Klebsiella. This is the level of pro-inflammatory cytokines, which are bad. So,
Yes.
so if you give a good microbiota, that helps in COVID. So people who have recovered faster, there has been a few papers which they have looked into the gut, and they have found out that if you have more of lactobacilli in your gut, then the chances of recovery is higher. And suppose if you have got a bad bacteria in your gut, then there is an increased cytokine, there is an increased severity of COVID. So that is why we are, for last 1 hour, we are talking about have the food which is good for your gut, which is good for immunity, and which is good for your health.
Very true. Thank you so much.